All right. Hello, everyone. Thank you so much for being here this evening. Welcome to the NAMI East Side Monthly Educational Forum, sponsored by Evergreen Health. My name is Emma Geary. I use she, her pronouns, and I am the Education and Outreach Coordinator here at NAMI East Side. So, for those of you who may not know, October is ADHD Awareness Month, and so our forum tonight is going to be a panel discussion with two local providers to chat to us about ADHD, answer some questions. We're going to be doing a panel style forum tonight. So we have some prepared questions that I'll be uh, facilitating with our two providers, and then we can have audience questions towards the end. If something pops up and you're like, I gotta write it down so I don't forget, feel free to put that in the chat, but we will take audience questions at the end of the forum. And with that, I am going to pass it to our two providers to introduce themselves and we'll get started. Rose, do you want to introduce yourself?
Sure. So I'm Rose, she, they. I'm an executive function coach with Catalyst Counseling. I have 12 years of experience working as an occupational therapy assistant before my transition to EF coaching. And EF coaching is the executive function support for skills like memory, goal setting, emotional regulation, and organization. So a lot of the functional cognitive skills related to neurodivergency.
Awesome. Thank you.
Hi, it's good to see everyone tonight. My name is Mai. I use they, them pronouns, and I am a licensed social work associate in the state of Washington. And I primarily do counseling or therapy with teens and young adults, and also some older folks. But primarily, I focus working with queer and trans folks, people in the BIPOC communities. And oftentimes, I also have a lot of neurodivergent folks, and kind of a lot of intersecting identities. Um, and I previously have experience in being a therapist in middle schools, and also working at Children's Hospital. Um, and I'm so excited to share some of our knowledge with you all.
Wonderful. Thank you, Mai, and thank you, Rose. Well, let's just start off tonight's discussion or panel by kind of defining some of the terms you've already used. Starting with what is ADHD, and I'll tack on to that what is neurodivergence or being neurodivergent when we use that phrase. Mai, do you want to take that one first?
Yeah, so for ADHD, some folks may also know this as ADD. It's maybe more of a little bit of an outdated term for our purposes here. Oftentimes, when we refer to ADHD, it's attention deficit hyperactivity disorder. Contrary to the name, it's not actually a deficit in attention. It's quite actually a difference in how the brain manages attention, emotion, and motivation primarily. I would describe it as having a race car brain with some bicycle brakes, is what a lot of clients tend to experience it as. You have a really powerful engine, folks that have a lot of energy, creativity, and drive, but sometimes the brakes just don't work the way you need them to. So for teenagers, I would say, and kids, it looks a lot more like trouble sitting still, maybe zoning out a lot, emotional outbursts and reactivity, or losing things constantly. I know many that lose things constantly. But for adults, it may look a little quieter than that. It may look very different. So it could be like procrastination, inconsistency, like burnout, or feeling like you're lazy, despite maybe trying so hard. So these are some of the things I look for, especially when folks are coming to me with a lot of like a myriad of kind of troubles, kind of zoning in on these specific parts of attention, emotion, and motivation for ADHD.
I mean, that was incredibly well put for really capturing what ADHD or ADD can look like in kids, teens, and adults. I think the other thing that I have history of looking for comes down to parents and teachers and kind of the responses you get back from them my child's constantly going. They don't have breaks. This is a student who's highly impulsive. Because again, that's a great example. It's a race car brain with a bicycle brake trying to slow it down. There is no slowing it down without work on the motivation, the self-awareness, and I would throw in including like sensory regulation. And a lot of my adults, burnout is one of the first things that I see on my end, and a lack of awareness of how to get to where they're trying to get to and what's going on in their mind and their body. There's a lot of this sensation of feeling out of control. And oftentimes it's because they've grown up with being told, no, that's not what's going on. No, that's not what you're experiencing. That's not right. That's not how you do this. And so they lose that connection with themselves and how to listen to themselves and what their needs are. As far as neurodiversity is kind of a step up. So it's the larger umbrella that captures ADHD, autism, OCD. I believe they're also including PTSD in there. So it's a lot of the various things that make our brains work just a little bit differently than what we would consider in the neurotypical expectations of memory, focus, motivation, attention span, goal setting, organization, all of these different areas.
Thank you. Yeah, I hear you both touching on the different experiences that youth may have or adults may have. Some of those, of course, may be crossing over in terms of symptoms or common experiences. How might ADHD also look different for women and girls? Similarly, we touch on how might it look different for people of color when maybe these are populations that have been underrepresented in studies on this diagnosis or just underdiagnosed in general when it comes to ADHD.
I would say that, like I was saying earlier, that a lot of folks that come through my practice are often like femme, girls or women, or people of color. Um, that actually have a lot of ADHD, but are coming in for something different. Because girls and women or people socialized as women are frequently underdiagnosed by miles. Instead of being seen as like hyperactive, I would say they're often labeled as anxious or shy or overly emotional, these very typical kind of labels for people that are socialized as women. Um, I would also say that people of color, uh, they face another layer where maybe behaviors that could be labeled like energetic in white children may be considered defiant or disrespectful. These are parts in diagnosis actually for children in the kind of standardized screenings that we do, where kids that aren't white are typically screened as more oppositional or defiant. I would say that the diagnosis rate is really shaped not just by biology, but by bias a lot of times, which is why a lot of providers are at least trying to shift language from disorder to difference, from this idea of like deficit to neurodivergence.
I would say on my end, for both my AFAB, assigned female at birth, and BIPOC clients, there's less room for neurodivergency in general. They have much higher standards of expectations of what things should be, what they should be able to do, how ADHD looks. And so a lot of the times there's a lot of education of how a lot of the research has been done on white, cis, assigned male at birth individuals and children, and that the research is coming out that it does look differently in girls and BIPOC clients. I've had, I wish I didn't have to say that I've had several clients come in who have that oppositional defiant disorder on their charts. And once we actually get into it, it's the much softer, subtle demand avoidance or hyperactivity or impulsivity that white children often get away and they're it's just children being children. But with BIPOC, it is seen as aggressive and a problem. The other thing I would often say with girls is ADHD can also come across as very outgoing, very engaged and involved, and miss the signs for perfectionism and early signs of burnout in young girls who are seeking acceptance from others. And so they're never really taught to slow down and pace themselves because they're just seen as being in pursuit of more education and more acceptance in acceptable behaviors, whereas their male counterparts are excitable and bouncing off the walls and energetic. So it does present very differently. And I'm really glad there's more research going into how those presentations look.
Thank you both. And something, just as we're establishing a common language together in this space, you've both already touched on how maybe this is something people learned to call ADD. Now we might use a term more like ADHD. Also changing from disorder to difference or using that type of language. How overall have you seen the language change around ADHD over time? Go for it, Rose. I can see you reaching for the unmute.
Actually, I don't have as much for this one. I would just say that if we take a step back from ADHD and look more globally at the acceptance of disabilities and neurodivergencies and chronic illness and invisible illnesses, we're seeing a massive wave of acceptance that not everything is what it looks like, that we aren't taking symptoms just at the surface, and that whether somebody is diagnosed or not doesn't change the fact that they're dealing with things differently or not. Within children, we're seeing a lot more acceptance for not teasing and bullying the child that's different, but, isn't it cool that they're able to do this? Or isn't it cool that they're able to do that? And the acceptance that ADHD is just, or neurodiversity in general, is just more accepted and more accessible means that we're seeing a lot more open acceptedness to let's just try something a little bit different. And the changes in that perception and that acceptance comes with the changes in the language, and whether the language itself changes or not, the acceptance of what that means changes.
Yeah, I would also add that, I'm sure maybe you even said it, that people are often saying these days that it feels like everybody has ADHD. And that comment, while it's very casual, actually carries and shows so much of the stigma with this diagnosis that lots of folks have been kind of stumbling upon. I think what's actually happening is that people who have always had ADHD are finally being recognized, especially like Rose was saying, women, BIPOC individuals, queer adults who perhaps were missed earlier in life, where oppositional disorders don't really match, or the screeners weren't really matching specifically the population that we're looking at. I wouldn't necessarily say it's a fad. I think it may be a long overdue course correction. But I also would say that social media has definitely played a big role. Sure, there's a lot of misinformation online. I know a lot of providers deal with that a lot. But I think there's also some really valuable community knowledge that goes around from social media as well. Like for many people, seeing ADHD traits described in very relatable ways feels like a breath of fresh air. It's the first time they've realized, like, oh, this isn't maybe a moral failure of mine. I'm not just lazy or bad. It's actually a difference in how my brain works.
Thank you both. Yeah, that is definitely touching on ultimately what we want to address tonight, of course, which is just learning together about ADHD as a community, but also how we address some of that stigma that comes up in these conversations and encouraging people to talk more openly about what their experience has been and to seek that community and support. So, thank you. Let's talk a little bit more now about just getting diagnosed if there are folks who are seeking an ADHD diagnosis. What does that typical screening process look like? Does it differ for, adults versus children? Or are you generally looking for the same things? And what might be some common I mean, you've addressed already some of the systemic barriers around identity that folks experience as a barrier to getting diagnosed. If there's anything else you'd like to add in there, and I'll turn it to Rose to start us off.
From what I've experienced with clients so far, finances, accessibility, and finding practitioners who are able and willing to diagnose adults versus children. The reality is the waiting list for children is very long. That's part of why I specifically work with parents of children, often with executive functioning, on how to create safe homes, because I know that the waiting list in local providers for pediatrics can be months, if not years long. And for adults, it seems to be even longer. I have clients that are looking 2 years out for being diagnosed, or simply calling places that do diagnosis and being told, our waiting list is just closed. Like, we can't ethically add more people to our waiting list. I've also heard from clients and friends that they've often run into practitioners where, when they're pursuing it as an adult, they're being told, if you don't have a direct caregiver who can speak to your childhood, we cannot diagnose you. We will not pursue any of the diagnostics. Or they're being told that there's no point in pursuing diagnosis. Having worked with other professionals who specifically do the testing, that's inaccurate. So if somebody is being told by a practitioner, we can't diagnose you if you don't have somebody who can speak from your childhood, find someone else, because you can still be diagnosed even if you don't have somebody from your childhood speaking to it. There are plenty of reasons to pursue diagnostics as an adult. I often tell my clients, if you're looking for medication, if you're looking for even just the understanding what's going on, if you suspect that you have ADHD and getting that diagnosis will help ease and support something in yourself, then it's important to pursue it. If you're looking for accommodations. When it comes to children, because I've worked in pediatrics for OT specifically, I often would tell my parents who were asking, do you think my child has ADHD? Is this something we should pursue? Should we look at diagnosis, or should they learn to do this regardless of their diagnosis? It is always better, in my experience, to pursue that diagnosis for children, not necessarily for the support of medications, but specifically for the support they can receive in school. Children know what's going on with them, even if they can't communicate it. So they know that their brain is acting differently than the peers around them, that they're not keeping up, that they're not, that they have more energy than their peers do. And pursuing the diagnosis really gives them that being seen, being supported, being heard. And yeah, it's so much more important to help them find that when they're younger.
Yes, absolutely. I feel a lot of the work that I do is supporting and communicating with school counselors in finding out plans to make it so that this kiddo can succeed. I would say traditionally, when somebody, parent, child, adult, wants to seek an ADHD evaluation from me, I'm a master's level clinician. This process usually includes a clinical interview, questionnaires, and essentially reviewing their life story, especially around school, work, and relationships. So sometimes this includes interviews with parents or teachers, but still, getting a diagnosis can be very, very tough, especially because many providers don't necessarily understand how ADHD looks in, adults, women, people of color. Like Rose was saying, the cost and long wait lists, of course, and internalized stigma adds more barriers. But I would also say that, like Rose was saying, you can find somebody that will go through a diagnostic process with you. If you are looking specifically for medication, disability services, or accommodations, that's when you might have to go to a psychiatrist or a psychologist specifically. But master's level clinicians in the Washington state can and will diagnose for ADHD. And if not even making the diagnosis criteria, like we were saying, the screeners can be a little dated that we use. they're still able to write letters of support for these kiddos and just get more support for what they need at school.
Awesome. Thank you. When someone is considering seeking evaluation or diagnosis, Rose, I heard you speak to this a little bit about maybe the myth that is pervasive that it does not matter to get diagnosed in adulthood, and how, that, again, using the term myth, right, may not really be true. Um, what might you see as the pros and cons of someone receiving evaluation at a different stage in their life, youth versus adulthood? Um, and what might be again, kind of similarly, pros and cons of perhaps a self-diagnosis rather than a formal evaluation from a provider?
Can I say something?
Yeah, Bob, go for it.
Okay. I'm quote unquote diagnosed with adult ADHD, and I had a psychiatrist one of the last psychiatrists I had, uh, said that you don't need to get a diagnosis. In fact, he didn't want me to get a diagnosis. And I'm thinking about the reasoning why. And because if I got the diagnosis, then I would be asking for solutions and a cure, not a cure, but treatment, so I could be more normal. And like amphetamines, Ritalin, these addicting medications. And my guess is that's where that would bring me down that road if I had the diagnosis. Anyway, I went ahead and got the diagnosis anyway, and I sure do want all those stimulants, but because I have bipolar, and I've had several psychiatrists try amphetamines, and I get agitated. So I just don't, I just live with what I've lived with all my life, from when I was 8 years old, and just learned to live with it, and wish that apparently the bipolar is like ADHD on steroids. That's what one of the pediatricians told me. And when you think about the symptoms for ADHD, bipolar has a lot of those symptoms. So anyway, I'm living with it. That's all my input for the day.
Thanks for
Thanks.
sharing your experience, Bob. I appreciate it.
I think Bob brings up a really important part, that sometimes why we are pursuing diagnosis or what the intent is can be an important part of the conversation. My philosophy for the coaching that I do is that there are so many different life experiences that can cause a temporary executive dysfunction, problems with memory, problems with focus and with organization, hyperactivity, depression, anxiety. There are so many things that can cause a temporary state that for the clients who come to see me, we treat it all the same, whether it's a chronic state or a temporary state. So the work that I do is not reliant on a diagnosis. However, there are plenty of things that are. The medications are reliant on a diagnosis. You have to have the diagnosis to get the medication. Some accommodations through the state disability requires the diagnosis. So if you are pursuing medication, if you are pursuing accommodation and disability, then yes, you need to pursue it. And that's how I approach it with a lot of my adults. As I said, with kids, it's so much easier to get those accommodations in place and to understand, and for them to understand what they're going through. But as adults, we already know who we are. We know what we're experiencing. So formal diagnosis may be a lot of long waits and a lot of money that we may never be able to actually afford and achieve. So some of my clients, we do go through the self-screenings together and look at their answers and decide, do you resonate? Is this where you want to identify as having ADHD or other neurodiversities? And if they say yes, then we talk about the generalizations. Okay, most individuals who have ADHD may present this way, may have these executive dysfunction struggles, may have these other struggles. And this is how you can support it in a non-medicated lifestyle change, support change directions. So it really comes down to, what are you after? What are you interested in? If you're just looking for that self acceptance and finally something that explains why I'm different, why there's something going on, why I'm having such a struggle and I can't keep up with my peers and my coworkers and my partners. I also work with them on navigating. There's a difference between ADHD as an explanation and ADHD as an excuse. And so for individuals who are looking, just give me a diagnosis so that I can tell people what's wrong with me, that's not a reason to pursue the diagnosis. There's added layers there of what's going on. So really comes down to why, as far as the pros and cons.
Yeah, I think Rose definitely hit it on the head. I would also say that, along with the relief that diagnosis can bring for many folks, I think especially for adults, it can bring a lot of grief. I feel that most of the time we're working on a lot of grief in my work with adult ADHD clients, because there's so much time that they've lost blaming themselves for, a lot of the ways that they normally act that don't align with the grander normal. That's why oftentimes it's really important to have the support of anybody that knows your situation, post-diagnosis too, if that's something that you want to pursue. I would say another reason why people might choose to pursue diagnosis with a psychologist or PhD level clinician specifically, I would say because of co-occurring conditions. Because ADHD often overlaps with autism, anxiety, depression, OCD, trauma, a lot of different co-occurring disorders. And actually, there's a term for a very common overlap of ODHD or autism and ADHD. It's being increasingly recognized as kind of a overlap in the constellation of symptoms. And I wouldn't say that means anything's wrong. It just, as I was saying, it just means our brains are so interconnected in a way that's very different than how we have done research on a neurotypical brain.
Awesome. Thank you both to speaking to that. And that, I feel like that transitions us perfectly into talking a bit more about support and therapy and what different forms of treatment or therapy modalities may be options for folks. Of course, there are many different paths and treatment plans and types of support that all individuals with mental health conditions and disabilities may benefit from. We know that what works for one person may not work for everyone, and that is okay. And there also are maybe some common types of treatment or coaching or therapies that may typically work well for folks with ADHD. And I know that you both offer, through your practices, different types of support for individuals. So we'll start with Mai, what types of treatment options or therapy modalities are there for people with ADHD?
Well, like you're saying, there's quite the variety. So oftentimes what I like to say is that with clients, I like to take a very multi-layered approach because it is very multi-layered in their lives. Medication can be one option to help balance brain chemistry and focus, but it is really not the only path. And I think a lot of folks can be very scared that medication may be the only path forward for them. A lot of other supports include building structure into their lives, adding movement and mindfulness and rest into the routines of their life. Specifically in therapy, a lot of what I teach is dialectical behavioral therapy or cognitive behavioral therapy adapted for ADHD specifically. And all of these, I also would say, are trauma informed, the way that I practice them, because not one size fits all, and there's so much more to the story that kind of shows up as we do our work together. And I would say that a lot of sensory tools. So looking at the different ways that we can engage with schoolwork, with play, with our families, that can be really helpful for not only kids, but really for adults. I would say that family members play a very huge role in doing any kind of work around ADHD and management. Um, they often can help create structure without the sense of shame, and celebrate effort or perfection. This can also be a very hard struggle for ADHDers who, you know, will put in lots and lots of effort and not get a result that they want. Alongside just like learning about what ADHD and how it shows up in the person, having external supports to really keep the person accountable, but also build a structure and community for them to thrive in. Because we know that compassion helps brains regulate better than criticism ever could.
To continue the little bit of echo about having family support, I often found working in pediatric OT that when the child or children would get diagnosed with really any of the neurodiversities, so many of them tend to have a family connection that often we'd start looking towards the parents, and parents either getting later diagnosis or being able to recognize, oh yeah, no, I absolutely acted the same way when I was a child. It's very likely that I have this too. You start to see more camaraderie. You start to see more of a relationship develop between parent and child or caregiver and child, because the caregiver is able to kind of heal those childhood wounds, and the child is able to see like, oh, this gets better, or I'm not alone. I'm not the only one who has this. From the coaching perspective, as far as support for ADHD, I love the continuation that medication's not the only route. I know that's the one that we tend to focus on. We tend to look at all of the ADHD medications. How do we get the medications? Who has the medications? How do we support the medications? And as we've often found the last couple of years, those medications run out. The pharmacy runs out of them and doesn't have them. So being able to have the skill sets to navigate the challenges of neurodiversities without the medications can help support that journey so much. So being able to work on even something as simple as time management. One of the common symptoms of ADHD is time blindness. And so I often have conversations with my clients. What does time mean to you? What does it look like? Do you blink and suddenly 4 hours are gone? Or is it this slow creep that you're constantly aware of and checking and navigating? Do you already use a bunch of timers in your phone to keep you on track? Are you somebody who's always late to things? And then how do we build into your routines ways to get you places on time, ways to transition you from one activity to another? And so I'm glad Maya brought up the sensory regulation portion of this. We often talk about the emotional regulation of individuals with ADHD, but emotional regulation really does start with sensory regulation. When we talk about our senses, most people know the top five, and that's what they start focusing on, vision, hearing, taste, touch, and smell. But we have three more, and that's our sense of gravity, our sense of location and the horizon, as well as what's called interoception, the sense of our internal bodies. So if we can't connect to our senses, then we have a much harder time connecting to what our internal bodies are telling us. And that internal connection does include emotions. So it makes complete sense why somebody with ADHD might be seen as going from 0 to 100 or constantly changing emotions. That interoception loop hasn't been completed to be able to be proactive about how to manage our emotions, how to manage our sensory needs, how to get our movement needs met so that we can sit down and focus at work, at school, and really how to balance all of that.
Excellent. Yeah, you both are touching on, right, lots of different options for folks for creating a wraparound approach to help support someone, not just in a therapy session, not just in school, but lifelong support to build those critical skills to, feel supported and successful. And so that really brings me to talking about a term I've heard you use already, which is executive function. And I would love, Rose, if you could help define executive function a little bit more for us, and also talk about why executive function coaching would, support a person with ADHD or even individuals who do not have ADHD.
Absolutely. So, executive function looks at 8 main areas of cognitive function. You have time management, organization, task initiation, goal setting, emotional regulation, memory and focus, self monitoring, and work life balance, or often school life balance when it comes to working with kids and teens. These are all functional cognitive skills. These are all skills that everybody uses, everyone navigates through, and to a certain degree, everyone is going to have a slightly different strength in all of these different areas. But what we've recognized is that with different neurodiversities, we start to see a more predictable pattern when it comes to these executive skills. So, individuals with autism, for example, are going to be slightly more on the sensitive scale when it comes to emotional and sensory regulation. Individuals who have high perfectionism are going to have slightly more concerns in their work life, school life balance. Individuals with ADHD, we're going to be taking a closer look at time management and organization. And so, as I mentioned earlier, everyone has the possibility of having an acute dysfunction in these. If you think about the difference between pregnancy and having a child, moving across the country, changing jobs, if there's a death in the family, all of these things can cause a temporary state of dysfunction. When things like stress get really high, our organization skills might get rough, our time management gets difficult, emotional regulation gets difficult. And so being able to recognize that this is something that everybody experiences means that we can normalize the use of the tools and we can find solutions to kind of fill in those gaps. I often describe it that we don't get upset if somebody breaks their leg and they're in a cast and suddenly they can't run a marathon. We can cognitively break down what that means, and that's going to mean, okay, there's a recovery time. And when the cast comes off, they still can't immediately go run the marathon. They have to go into physical therapy and strengthening and recovery. But we don't really have a good analogy that connects executive dysfunction. When something goes wrong that derails that pathway, there is a recovery time to it. And so being able to develop the pacing that brings that recovery back up to full function and full capacity.
Yes,
Yeah,
I
my
think. Oh, I was
Go
gonna
for
say.
it. You're good. Please add on.
I was just gonna say that as a provider, I don't think it is our job to nitpick diagnosis. This is really a situation where Rose is saying that we're trying to listen for what they're really asking for. Executive dysfunction happens. Often what they need is validation, support, community, and relief. No matter what it overlaps with. Like oftentimes we see, a lot of folks with depression have really low energy and focus, or with anxiety, there's a lot of avoidance, maybe some perfectionism. Rose listed a lot of other overlapping things with autism. I think as a provider, what I really focus on is like what the client really needs versus maybe this label or the diagnosis that they may be seeking.
Thank you for adding on to that. Thank you, both of you. There's definitely here at NAMI, we really emphasize the importance of community and connection, which I'm hearing both of you share about as well. I want to acknowledge I saw a audience question in the chat. We will be getting there shortly. Really, I just want to wrap up this portion of tonight's forum by addressing ADHD stigma, which is something both of you have already spoken to throughout what you shared tonight. And yeah, like Mai shared at the beginning, that there are certainly advantages and disadvantages to having so much access to information on the internet. One advantage of that is individuals who maybe hear about others explaining what ADHD looks like for them and feeling some connection to that story or having it resonate with things that they've experienced in their life. Um, and we might be seeing now just what feels like that sentence of everyone has ADHD now, or that we're maybe seeing this uptick in late ADHD diagnosis in adults, or even just seeing it becoming potentially more common in children and the folks around us. Um, so how can that type of thinking or framing of ADHD be potentially unsupportive or harmful when we talk about things like neurodivergence? It's kind of a complicated question. I'm sure there's not just one answer, but whoever feels called to it, Maya or Rose, I'd love to hear your thoughts.
Um, I think this is like one of the more interesting parts, especially because a lot of times right now when I work with teens, there's a very big gap between the adult that's the parent and the teen that's on TikTok. So when a client is saying, I think I have ADHD, what I hear and I'm looking for is, I'm tired of feeling broken. I want to understand why I can't keep up with all my other classmates, or I just want life to feel doable at baseline. And I think that's a large part of the work of providers, but also people in community that know folks that may think that they have ADHD. I think that's the work, is to help them externalize this blame and see their struggles in the context of their life and reconnecting with this self-compassion of, oh, your brain, I don't actually think it really needs to be fixed. We would like to have some more language around it. We'd like to have some more systems and support around it. But reducing stigma around ADHD, I think, really means rethinking about what we value. Because we built and continue to build systems that reward endless focus and productivity and self-sacrifice. And I think ADHD challenges those norms. I think it reminds us a lot of times that rest and creativity and a rhythm are very important to how we operate as humans. And so I really just emphasize that even when we talk to others, that we're talking about how we're different and we're uplifting people's lived experience, because there is nothing scarier than to say, I feel broken and I am different. And it comes at a cost. It comes at the cost of relationships, jobs, schools. And to really affirm that, like, yeah, that sounds really hard. I want to help you, or not even help you. I want to be here with you. Can we like take away the stigma around stimming or being too body double or be hyper focused on something like that? Is worth celebrating to be able to do something different.
I don't know that I can add much more to that. That like perfectly captures about where I was going to stand on this. That the whole perception of just, everyone has ADHD these days. It's the same with any other medical condition that's out there being researched and being diagnosed. We start with recognizing the farthest extremes of a diagnosis, the thing that looks the most different. So, of course, we started with what it looked like in hyperactive children who could not sit still, who could not follow any of the rules. And now that we have a clear sense of what this looks like, we're starting to recognize, okay, so if this is ADHD, what is it if we come 1% this way? What if okay, we've taken that 1% step, what's one more percent? And this is how this works with any condition, with anything that doesn't have a real solid set blood test that shows, okay, here is a marker, that big flashing sign that says you have this diagnosis. Anything else that is going to be based on these symptom sets, that is going to be a little bit more, I am losing a word here, a little bit more fluid. We are going to start with, this is green. Okay, so is lime also green? And so you slowly start to see that expansion come in. And that is going to mean that there are missed diagnoses and people who are diagnosed later in life. It's not because it's a trend, it's because we understand more. We have a better sense, we have better diagnosis, we know what more of this looks like. And opening up that stigma just means that the individuals who are over here who are still ADHD are getting the same support that the individuals over here are. And we're able to just even the playing field a little bit more and accept people where they are and not I work a lot with you're not a robot. Robots give 200% and are consistent and perfect every single time. Humans are not robots. So how do we pull ourselves back to 80%, 90% and be okay with that and be good with that and still be doing quality work that we are happy with? I think one of the largest dangers with not addressing the stigma, with not getting diagnosed, with not pursuing that, Maya really spoke to this idea of we see this in children. They know there is something different. They know that they're not keeping up. They know that they're not behaving the same way. And you just continue to watch that be internalized. I am different and there's no one else like me. And that really starts to ostracize people, either as children or adults. So being able to really click into it, this isn't just a mental health perspective from the idea of this is a mental health condition that needs support. This is a mental health perspective from people seeking community and being understood and being heard. And the more the stigma is there, the less people are going to find that community and that support.
Thank you both. I'm really grateful for your thoughts on this, and even just, having an open dialogue together as a community on various topics related to mental health, including ADHD and other neurodivergent experiences, I hope can help create that basis for people to start opening up, sharing their experiences, seeking support, and feeling safe to do so, especially with providers that are clearly very deeply caring, like the two of you are. We certainly need more of that in our lives. So with that, I am going to open it up to the audience. I do see one question already in the chat, so if you would like to ask a question for Rose and Mai, please feel free to place that in the chat, or you can, use the little raise hand feature if you know how to do that, or unmute. But I'll start with this first question here, which is asking, can either of you speak to someone being, quote, under stressed or under motivated, especially in the body of a very indifferent 17-year-old assigned male at birth, or AMAB?
Connection. A lot of the teenage clients that I work with, I make it very clear to the parents that rapport building will take several sessions. You have to find out what is their motivation. They're going to be passionate about something. They are going to care about something. And it may not be what you find important. It may not be even what someone else might find important, but there is something. And if somebody sits there saying that there realistically isn't, we start going backwards in time, because there was something at some point that somebody teased them on or picked on them on or told them that wasn't important and told them that wasn't a motivation. And so they pulled back and they continued to pull back. I'm also looking to see, is this a individual that is feeling heard, that has a voice and has the capacity to speak to them, to their experiences? And once you're able to establish that connection and get a rapport with them and build that voice and find out what they're passionate about and engaging with, now you can start to find out how to connect it from there back to things like school or chores or their own care for themselves. But if they don't feel like they're being heard, they're never going to speak and they're not going to engage, and they're going to stay undermotivated and underengaged because it's likely what they've seen so far is, what's the point? Why should they? So you need to give them that point and the why to a place where they'll actually engage.
Yeah, I definitely agree. Working with a lot of indifferent teenagers that don't know why they're in my therapy room. um, they will, their nervous systems often can be running in a kind of like energy economy mode. So, like Rose was saying, a lot of years of feedback of you're not trying hard enough, or you're so smart, why aren't you applying yourself? Over time, this creates a behavior, this protective response that makes it feel safer to not try than to risk trying and failing again. Or they don't care about this specific thing. As long as they don't care at all, their brain just doesn't ignite the same way unless there's some novelty, some urgency, or some genuine emotional connection with other folks. So I would say that, especially with kiddos like this, instead of pushing for motivation, which can be so very fleeting, maybe we can turn the focus to connection and validation and some co-regulation, helping especially young folks learn about how to name what's internally going on builds a sense of awareness and trust with you, which often is what precedes this change that maybe adults might want to see a little more.
What other questions are there from the audience?
Got a question. I think it was Mai who mentioned that maybe it was Rose who mentioned that there were questionnaires for determining if somebody's on the ADHD spectrum, I guess you would call it. And I'm wondering, does ADHD is that something that's in the DSM, or is it's separate from a psychiatric diagnosis?
Yes, it is currently included in the DSM-5, the most recent edition.
Okay, thank you.
The questionnaire that I was speaking to is that there are several online searches that you can do for kind of a ADHD and autism screening. And the idea is if you get a above a certain score on these screens or enough of these screens, that it kind of gives you the idea of should I pursue diagnosis if that's something I want? Is it likely that I'm in this range somewhere? And sometimes that can help on a low end if someone's really, I don't know if I have this, I don't know if I have that, and it can help provide a little bit of guidance, but those questionnaires are not diagnostic. They're not going to confirm the diagnosis, but it can be helpful to say, yes, you should pursue more or not for somebody who's looking for that validation.
Thanks.
Thank you, David. What other questions are there? I will take the current silence as there are no remaining questions folks want to ask right now, and that is totally okay. If for all the folks who are here tonight and who registered for this forum, there was a question in the chat asking if this recording will be available for people to share. Absolutely. This Zoom meeting will be has been recorded and we posted on our YouTube channel, and will be sent. The link for that will be sent to all the folks who attended and registered for this forum, so that you can rewatch if there's anything you'd like to glimpse again, or to share out with others. But with that, I just want to take a moment to really thank Rose and Mai for their time and expertise and sharing their knowledge with us this evening. It's been so really just wonderful to hear from both of you, and I appreciate you coming and being on this panel with us. So thank you. Thank you again. And for everyone else, thank you also for spending your evening with us. We are so grateful for that. And if you would like to continue seeing what topics we chat about, the NAMI Eastside Educational Forum is a monthly virtual forum sponsored by Evergreen Health, and you can attend these every month. They are on the last Tuesday of every month from 7 to 8 p.m. over Zoom, and you can find out more information about the topics or even suggest a topic. This topic tonight was suggested by one of our community members, and I'm so grateful for them raising that as an important topic tonight. So please do check out our website and register for the next meeting. But with that, again, my name is Emma. I'm the Education Outreach Coordinator with NAMI East Side, and thank you for attending our monthly educational forum sponsored by Evergreen Health. And I hope you all have a great rest of your night. Take care.